Well, thank you very much for that introduction. And yes, I work with the Research Delivery Network in the region of South London. And those of you who are familiar with the NIHR infrastructure will know that we are quite new. We feel new, although that we're probably more established now than we probably give ourselves credit for. But to work as a strategic development director within a region as South London is a real privilege. And it's one of those jobs that I think is the key to pulling everything together along with all of the teams that work within the regions to really consider how we do the best for our communities and how we can make that a scalable influence to influence actually national policy. So this has been quite an emotional morning for me, not going to lie here, because I actually started my career in a care home when I was 17, and it wasn't the best experience. I'm not going to lie. The interview was, do you know any old people? Yes. Thank you. Can you start tomorrow? There was no training. There was literally nothing that put me in any position to be of help or use than using a little bit of common sense. And that is why I am a nurse and not an archaeologist. So I do feel that this has actually been a bit of a poignant morning, that I've come full circle. And one of the things that I questioned at that time was, hang on a minute, surely you can do better. Surely we can do better than this, and I can do better. So it was always going to be that I was destined to work in research, and now I have the absolute privilege of working with some incredible researchers, some incredible people who put together so much of what we do. And if you think about the last 20 years of the NIHR as a whole, the University of York tells me that there has been £200 million worth of investment within social care, over 400 social care projects. I thought, wow, that sounds great. But now we have the opportunity as part of the wider NIHR, as part of the Research Delivery Network, which serves to help minimise barriers and to really think about how we can bring all aspects of health and care research together. We need to be thinking a little bit more about how we put that together in a really meaningful way. So we've started doing that as the RDN. You know, we're looking at regional strategic funding and how we can really pull some of these collaborative opportunities together. And we want to see that really turn into something which is scalable to a national level, and that we've got the opportunity to make the change where it's most needed. We're here to make a really innovative opportunity for delivery of the research portfolio. And what we bring is the resource, the expertise, the infrastructure, and that system-wide approach with the relationships we have with all parts of the NIHR. You'll all be familiar with the 3 government shifts, but of course one of the biggest opportunities here for us in social care is hospital to community. We need to look at care pathways and research participation that are entrenched in place-based care. Neighbourhood health. Now, if this isn't something that's actually going to make sure that we have a really bespoke opportunity to bring healthcare to where it's most needed, I think that that's really quite incredible. So we have been evidencing pathways to keep people out of hospital where possible. We need to think about bringing research to those opportunities as well. If we think about the successes of research and the fact that we're able to manage now so many more longer health term conditions, but that actually gives us a bit more of a complex need when we start looking at the older population. So what do we need to do to be prepared for that? And we've seen with Raphael's work, you know, the scale of what that need is likely to be. So we best start now, I think, is the message. So, you know, we want to be able to move those complex health needs and the opportunities into a space where more people can access it, and that we can look at the information and evidence that we've been generating over all this time, try to link data, understand data, understand where the evidence is, where the gaps are, and what the need in social care actually is. And that brings us to analogue to digital. It's not just about giving everyone a phone. This is actually more about how we make use of all of the information and evidence that we've got and be able to put that into some sort of sense and order that will give people the opportunity to design those research questions for the future that are going to impact really positively on social care. Training, knowledge exchange, all of these things are vitally important. I had no training. I was just expected to go in and deal with things and make a decision about what was right. Very hard because, you don't actually know what you don't know until you're in a position where you're not knowing it. And really, we need to be thinking as well about the opportunities for sickness to prevention. If we think about early detection of illness, advanced warning of complications and how we actually build that into people being able to live in their own homes for as long as they want to be able to access the right level of care support for their needs. It's not just about warehousing elderly people. It's about how we give people the opportunity to live their life as well as they can for as long as they can. So this is also about, we want healthier communities, healthier workforce, better choices, make better choices, have better choices. 20 years of NIHR innovative investment in evidence has enabled research delivery to evolve and to grow. And as the NIHR and particularly the Research Delivery Network, our single identity helps us to challenge and overcome these barriers, share and mobilise knowledge and generate capacity for innovation in research delivery. We're here to deliver the NIHR portfolio and to overcome barriers, and nothing's off the table. We need to build down these barriers and really think about how we can do so much more with what we've got. So the RDN essentially brings people together. If you don't know who to talk to about social care research, come and talk to us. Because if we don't know, then we can at least put you in touch with the right part of the infrastructure. And just before I hand over to Dr. Nicola Brimblecombe and Dr. Javiera Cartanea Farias, I hope that's almost right, thank you. I just want to say one more thing, and that is, how can you do better? What must we do better? What is my opportunity to change for the better? Please work with us, work with the research delivery networks, work with the NIHR in any way that you can, and really think about how we can pull all our evidence together for better. Because I feel like I've come full circle and I'm outstandingly impressed and quite emotional about the amount of work that's gone into social care and really how we've done so much. But please, let's just do so much more. And I'd have made a rubbish archaeologist because I hate rain and mud. So thank you very much. I'd like to hand over to my colleagues.